Today I will be discussing about heart, its conduction system and normal rhythm. Let me introduce myself. I am Dr. Rajni Chaudhary, professor and nursing educator. I'm trying to cover some important topics for nursing students and for NCLEX exam. My focus is on safety and priority care for our clients. Today, as I said, I will be discussing about heart and conduction system. So this is a diagram of heart and we have 4 chambers in our heart. The 2 upper chambers are called atria, the right atrium and left atrium, and 2 lower chambers are called ventricles, right ventricle and left ventricle. All deoxygenated blood from our body enters the right atrium through inferior vena cava and superior vena cava. This deoxygenated blood which enters through the right atrium, it actually goes to right ventricle through a tricuspid valve. And this deoxygenated blood further goes to pulmonary artery into the lungs. In lungs, this blood gets oxygenated and it comes back to left atria through the pulmonary arteries. So left atria receives the oxygenated blood. This oxygenated blood enters into the left ventricle through a mitral valve, and then this oxygenated blood enters the aorta and then it is received by the body and body. Next topic is conduction system of heart. The conduction system is made up of SA node, AV node, bundle of His and Purkinje fibers. Conduction system generates and transmits electrical impulses that stimulate contraction of myocardium. The conduction system first stimulates contraction of both atria and then contraction of both ventricles. The SA node is called a pacemaker of heart. The electrical impulses are initiated by the SA node and it's conducted through intranodal pathways. These impulses causes contractions of atria, both atria. The impulses then reach to AV node. The AV node coordinates with impulses and relay the impulses to ventricles after a slight delay. The impulses further conduct through a bundle of His, which further divides into left and right Purkinje fibers. This is the point at which the myocardial fibers cells are stimulated, causing a ventricular contraction. The ECG is composed of waveforms P wave, QRS, and T wave. The P wave represents the electrical impulses starting in SA node and spreading through the atria. The P wave represents the atrial depolarization or atrial contraction. The QRS complex represents the ventricular depolarization or ventricular contraction. The T wave represents the ventricular repolarization, which is ventricular resting stage. Let's talk about the PR interval. The PR interval is measured from the beginning of P wave to the beginning of QRS complex. It represents the time needed for impulse to travel from SA nodes, contraction of atria traveling towards the AV nodes, so just before the ventricular depolarization. The EKG paper provide information about heart rate, heart rhythms and electrical activities of cardiac chambers. EKG paper is a grid where time is measured along the horizontal axis. Each small box is equal to 0.04 seconds. Each large box represents 0.2 seconds. If you see, there are 5 small boxes in one large box, and if you multiply 5 into 0.04 is equal to 0.2 seconds. So this whole lane on or horizontal line on a big box is equal to 0.2 seconds. Let's look into this normal rhythm. There is a P which represents the atrial depolarization and measures between the normal range is between 0.08 to 0.08 to 0.10 second. In this, if you see, there are 1 box, 2.5 box, which is equal to 0.10 second. So that's a normal. The QRS is the normal range for QRS is 0.08 to 0.12 second. 0.08 to 0.12 seconds. If we look at this normal rhythm, it shows 1, it's almost 2. So it's 0.08 second, which is normal. The PR interval, which starts from P until here. So the normal PR interval is 0.12 seconds, 0.12 seconds to 0.20 seconds. If we count here, it comes 1 box, 2 box, and there are 3 box. So it's actually 0.12 seconds, which is normal.